Hi guys, this is Riley Davis. I'm doing my microbiology report for Dr. Cody on poliomyelitis. Let's get started. So basically, just a little introduction. So what polio is a virus that infects and destroys the central nervous system, but 95% of people infected are actually asymptomatic and show no signs of the disease. And there are three types of polio. There's PV1, PV2, and PV3, PV1 being the most notable, the most virulent, and I think PV2 and PV3 have actually not been, there are no cases that have been found since around 1999. It's the last time they've been seen. So it mostly affects children under the age of 5, and as you can see right here, what it does is it gets in there and it starts to destroy these nerve cells, and it can be in the spine, the brainstem, or both. And as you can see in this guy right here, his spine has begun to curve, and right here it often affects the legs, and they begin to curve. As you can see here, this girl has very severe polio, and it has infected the spine and her legs as well. So a little history. So the first infection probably happened about 6,000 years ago, as people have discovered these mummies in Egyptian ruins whose skeletons actually show signs of having polio. As you can see right here in this picture of the leg, the curvature here is a very common trait with people who have actually contracted polio. So 1789, though, is the first documented case, and it wasn't until 1954 that a vaccine was developed. But the thing is that polio wasn't very much of a big deal. It wasn't a pandemic until the 1800s, or it hasn't really been a pandemic, but it wasn't until the 1800s that it really became relevant and it really became a big deal. Many people didn't have it until then. And so one of the most famous people that you've probably heard of that have had the disease is Franklin D. Roosevelt, and he got it when he was in his 30s, and he had paralytic polio, which most people don't recover from. So as you can see right here in this picture on the left, in 1988, all of these in pink are countries that still had polio. And then by 2014, with use of the vaccine, polio has almost been eliminated and actually only occurs in Nigeria, Pakistan, and Afghanistan. And every once in a while, there can be an infection in a country surrounding. So what the virus is, it's part of the Picornaviridae family, which also contains the rhinovirus and hepatitis A, and it's the enterovirus genus, which means that it's able to withstand a low pH. So transmission is typically fecal oral, and so the virus is able to replicate in the throat, and when it passes down into your stomach, because it can withstand that low pH, it'll live through all that stomach acid and then continue on into your gastrointestinal tract and also replicate there. And that's when it starts to feed into your bloodstream and get into your central nervous system, and it starts to destroy those cells. So it's composed of an icosahedral capsid, and it's 60 copies of the 4 same proteins, VP1, VP2, VP3, VP4. And it's just the same repeating structure, and it's positive single-strand RNA. It's about 25 to 30 nanometers. So what happens is human nerve cells have this protein structure on the surface, the function is not really known for this structure, but unfortunately the poliovirus has a receptor. This CD155 is known as the poliovirus receptor that is able to attach to the surface of that cell and basically infect it. And what it does is it gets inside the cell and it takes over and it begins to replicate its own RNA. Oops, sorry. Oops. And then it kills the cell and moves on to infect other cells. Let's see. Okay. So someone who is infected with polio has the ability to get all three, or sorry, not all three, but these three options. So there's subclinical polio, which would include a fever, headache, vomiting, maybe a sore throat, and it's not very serious. Most people who have subclinical are fine, and about 99% of people have either subclinical or non-paralytic polio. It's only 1% that actually do contract that paralytic polio. So then you have non-paralytic, which would include that fever, headache, sore throat, and then maybe a little meningitis, a cough. But then you get to paralytic polio, and it comes with those same symptoms, the fever, the headache, vomiting, sore throat, meningitis, but also includes paralysis of the spine, brainstem, or even both. And this can include muscle pain, spasms, deformities, and as you can see in the previous slides, those deformities include deformities of the leg, often limiting people's movement. And then the poliovirus also gets in and starts destroying those muscles in your chest that help you breathe. And as you can see up here at the top, they developed this big contraption, and it's called the iron lung, which basically they would put people in there who had contracted polio and were no longer able to really breathe on their own. So they put the whole body in there and hook them up to this iron lung, which is not in use today. We have a lot. We've made big movements on the medical front to where this iron lung is no longer really needed. They have better respiratory help. And so basically, the way polio kills people is it limits their ability to walk, it limits their ability to breathe, and eventually, if you can't breathe, you die. And then also, there is post-polio syndrome. So people who have contracted paralytic polio and kind of live through it, anywhere from 10 to 50 years later, they can start seeing similar symptoms to what they had when they did have the virus. A little more of the paralysis, the muscle pain, spasms, and the deformities can even continue to worsen. But only about 1% can actually do have the paralytic polio and show symptoms for the paralytic polio. And in that, about 5 to 10% of people die. So the first vaccine was developed in 1954 by Jonas Salk, and that is going to be the inactivated polio vaccine, which is administered as a shot. And then in 1961, Albert Sabin developed the oral polio vaccine, which is taken orally. So right here is kind of some of the differences between the inactivated and the oral. And the inactivated polio vaccine is used more often as it is a lot more effective. So both of them are trivalent, which means that they both work to combat all three types of the poliovirus, PV1, PV2, and PV3. So the big difference between these is that IPV is an inactivated virus, but OPV is that live virus. And both are highly effective, but IPV is going to be more effective. And typically, um, when children are born, over the course of the first 5 years, children are administered about 4 doses of the IPV vaccine. The OPV vaccine is not used very often. But as you can see, there's a big difference here. A child becomes 90% immune, around 90% immune after 2 doses, but the OPV, it's only about 50% after 1 dose, and 99% here for IPV after 3, only about 95 after 3 over here. And they don't really know the duration of immunity here. But the good thing about the OPV is that if it does work and you have immunity probably lifelong. These are my references for my photos, and thank you guys for listening. I hope you guys enjoyed it. Bye.